The key objective of my research is really to understand the neuromechanisms of social interaction. In the past, a lot of research in the so-called field of social neuroscience has tried to investigate what brain processes are relevant when we observe other people. And this, of course, is already quite relevant and informative. But my research is really based on the assumption that there's something fundamentally different when people are in social interaction as compared to when they're only observing other people. And I would like to try and understand what differences there are at the level of the brain, but also at the level of collective behavior. And all of this is interesting to me from a clinical point of view. So as a clinical psychiatrist, I see patients who have what you could call disorders of social interaction. They have difficulties in social relations with other people. And it strikes me that often you cannot reduce these kinds of difficulties to malfunction of that person's brains, but that it would make sense to think about the other people's brains as well. So who is that person or the patient interacting with? And how could it be that maybe a mismatch in brain function across different individuals gives rise to psychiatric symptoms? So in terms of research methods, we focus on using a combination of methods. On the one hand side, we use functional magnetic resonance imaging to study brain activity, but we do so in combination with eye tracking, which allows us to track the eye movements that people make while they're looking at stimuli inside the MRI machine. In the past, social neuroscience has been satisfied by saying, let's put someone in an MRI machine, a machine that can study brain activity by using an indirect measure of blood flow, and to show, let's say, images of faces to that person. And afterwards, you can then look at the MRI data and see which brain region shows a differential increase of neural activity while someone is seeing a face. But this, of course, means that in such a situation, the study participant is merely an observer of another agent. But what we do in our research is we move from this observational stance that participants are required to take in an experiment to an interactive stance. And we do this in the following way. So we show faces to our study participants, but we also monitor their eye movements while they're doing this inside the scanner. And by using computer algorithms, we then analyze in real time where the person is looking on the screen, whether the person is looking at the face or at other things that we may present on the screen. And we can then also, via these algorithms, change in real time what the person sees. And this technique of using gaze contingent stimuli we can use to make the face that the person sees on the screen responsive in real time. So you can imagine lying in the scanner, seeing a face, which will then begin to respond to whether or not you look at it, similar to how a real person in real life may respond to you when you look at him or her. And in combination with functional magnetic resonance imaging, what this allows us to do is to look at the neurocorrelates of social interaction. So we can track which brain regions show responses. During this ongoing interaction, we can look at how different brain regions interact and coordinate activity in order to be an active participant of an ongoing interaction. I would like to explain the findings from a set of 3 different studies in which we used a combination of functional magnetic resonance imaging and eye tracking. In the first fMRI study, we investigated the neurocorrelates of joint attention, which is the phenomenon when individuals coordinate their visual attention. So they look at something together. And we wanted to understand whether it makes a difference in terms of the neural processes, whether joint attention is actually self-initiated or whether it is other-initiated. So whether or not I'm leading someone else's gaze, and then we look at something together, or whether I'm following that person's gaze. And in a first fMRI study, we were able to demonstrate that when I'm leading someone else's gaze towards an object, and we share the experience of looking at this together, this actually leads to a differential increase of neural activity in the nucleus accumbens, an important component of reward-related neurocircuitry. And moreover, activity change in this region also positively correlated with how pleasant individuals actually found the sharing of experiences. In a second study, we then went on to further investigate what it is about joint attention that is really motivating and intrinsically rewarding. And we investigated whether or not individuals were initiating joint attention in a context where they actually had a shared goal together with the other person, or whether this just occurred in the context of not having such a shared goal or an intention. And what the second study demonstrated was that it's not even relevant or not even important to have a shared goal, to have a reason why we should look at something together, but simply the fact of doing this together, again, brings out these responses in reward-related brain regions, which suggests to us that this might be a very fundamental and important aspect of brain function, that it brings us close to other people and that it implements an intrinsic motivation for social interaction. And in the third fMRI study, we then went on to investigate individuals that use cocaine over longer periods of time for recreational use. And we wanted to understand whether known decreases in social network size, so that cocaine users tend to lose interest in other people, might actually be related to the fact that reward-related neurocircuitry in those people's brains might become less responsive to social reward as in our gaze-based interaction paradigm. And our findings actually indicate that this is exactly the case. So when we measured cocaine users, we showed that we could not find a differential increase of neural activity in the reward centers, and that this decrease in activation size actually also correlated with those individuals having a smaller social network. So taken together, this suite of studies indicates that gaze-based interaction, or being in interaction, brings about and recruits very important aspects that are related to motivation and draws upon brain mechanisms which make social interactions normally intrinsically motivating. So in terms of relevance, I hope that our studies go some way of demonstrating that social neuroscience and the investigation of the social brain can actually be relevant to psychiatry. Because our studies show that when you focus on social interaction using interactive paradigms rather than social observation, it is actually possible to tap into the neuromechanisms which are relevant and are affected in psychiatric disorders, such as the case of cocaine use. And I would hope that continuing this line of research will also demonstrate that focusing on the neuromechanisms of social interaction will also inform our understanding about the neurobiology of other psychiatric disorders, such as autism, depression, and social anxiety. So using what you could call a transdiagnostic approach to the investigation of psychiatric disorders, focusing on social interaction, may actually help us to understand those aspects of the social brain which are really relevant for psychiatry, and could also be relevant for treatment and tracking change over time. In the past, what we've been able to do is to look at the neuromechanisms of social interaction in individual brains. But what, of course, we should be doing, if we want a truly social neuroscience, we need to investigate dyads or multiple persons. So the objective would be to study two persons' brains while they're interacting. And this is important because many of the social difficulties that individuals with psychiatric disorders face, for instance, are a result of the mismatch between their capabilities and the capabilities of an individual without a mental disorder. So it's important to also understand how the discrepancy across brains may give rise to social difficulties, which may not always only be found in an individual's brain. The way that we do this is by now developing our experimental platforms in such a way that we actually have two persons in the lab, and we engage them in games that they can play together or individually while being present in the same location, or also in a competitive manner. And we are developing ways of analyzing and quantifying at the behavioral level interpersonal synchrony and coupling. So how much do individuals respond to each other? How much do they resonate on a behavioral level? And by providing this quantification of behavior, we can then inform our analysis of brain data. And our hope would be that this approach can do something that has not been done before, namely to understand how collective behavior is represented in individual brains.